going to go ahead and look at the stethoscope and listen to our heart sounds. So in each classroom will get a set of a stethoscope and a blood pressure cuff. So when we take the stethoscope out of the package, we want to, we'll make sure our bells, these are the bells, that those are tight. Okay. And most of the time, the stethoscope will be in this position here. We can go ahead and bend those slightly. And, and they'll just fit in the ears more comfortably that way. Okay, so we can see that it's almost like it's pointed, kind of aligning with our nose. All right, and then also we want to spread these. If they're too close and these earpieces are too small, it may hurt our ears. So we can spread it out a little bit and just reset it. Now, once your teacher sets your stethoscope, I think it's good enough. Okay. If we share the stethoscope with other students, we want to clean the earpieces. Okay, and so it fits in like this. It should be very comfortable. If we put it in this way here, that's backwards and it might hurt our ears. So we're putting it in this way. We tap on the bell. This will switch over to the small bell for listening to babies, but today what we want to do is listen with the large bell. All right? And all of you can go ahead and listen to your heart by just placing it centrally located. All right, so our heart, if we can imagine our heart, if I make a fist with my left hand and I place it on my chest, if I place it there, it kind of corresponds to the size and location of the heart in the mediastinum. So we can see it leans over to the left, but it is not on the left side of our body. It is centrally located. So we can listen. We can just find our heartbeat. We can listen to that sound. And then if we look on the paper, you'll see some blue dots. And these are the places where we can listen to the different valves of the heart, or the different chambers. So there'll be two locations up high, here and here. So over here we have the aortic area, or the aortic semilunar, and then we have the pulmonic valve, or the pulmonary semilunar. All right. And then we can drop it down this way over here, and that's going to be where the mitral valve will be, which is on the left side of the heart. And then over here, we can listen to the bicuspid. Now let me show you again on our heart. Another thing about the stethoscope, we put it all the way around our neck, like so, or else we put it in our pocket. If we have a pocket, we can put it in there like so, or set it down. We do not do this with a stethoscope. So don't simply lay it over your shoulder and let it swing down, because it could hit the patient. And I actually had that happen one time. We were transporting a little old lady who had a heart attack, and I hit her in the side of the head with one of these bells, and it's very painful. Okay, so even though we're listening to the valves of the heart, which are, again, pretty close to each other, what we're going to do is we're going to place this bell a little bit further away. So if we're listening to the mitral valve here, we'll place it over here. If we're listening to the tricuspid, we're going to place it centrally located. If we're listening to the excuse me, the aortic semilunar valve here, we can listen to there. Actually, it's going to be on the opposite side. And then for the pulmonary semilunar valve, we'll listen here. All right? So I want to give you guys some time to listen to those sounds, and then I'll tell you what we're listening to. Let's find the mitral area first, okay? So I'm finding my sternum, and I'm just going to the left of my sternum. If you have thick clothing on or a sweatshirt, you might want to take the sweatshirt off so you get down to a t-shirt. Okay, the sound that you'll hear, and we'll just try placing it in different areas so you can hear that sound. You'll hear a lub-dub sound, lub-dub, lub-dub, lub-dub. And so what the lub-dub sound is, it's a closing of these valves, all right? So the lub sound is when these atrioventricular valves close. This is the left AV valve or the mitral valve. This is the right AV valve. And when these two close together, they make the lub sound. It's also known as S1. Up above, these two valves, they're called the semilunars, they make the S2 sound. All right, and so when they close, they make the dub sound. So it's going to be lub-dub, lub-dub, lub-dub. And so notice the position of the valves right now. They close at the same time. So these two will close at the same time while these two are open. So right now it's in the dub position or the S2 position. S1 when these close, S2 when these close, right there. Okay? So spend a little time just listening to your heart and simply try listening to it in different areas, wherever you can hear it. Sometimes some of us can hear our heart better than others, okay? Not only that, we can also get our heart rate. We can count our heart rate, just like we did on the radial pulse. We can count it by listening to the counting to the central cardiac area. If you don't even have a stethoscope, you can put your head and ear down to their chest as well. So that's another technique that can be done. All right?